Hi, I'm James, a knee, foot and ankle specialist, and today we're going to talk you through plantar pad atrophy. So, on the undersurface of your foot, we know that you've got a piece of cushioning under the heel and under the ball of your foot called the plantar pad. Its function primarily is to act as an extra bit of cushioning between the bone and the ground as you walk or as you run. It's normally 1 to 2 centimeters in thickness, and it's highly innervated by nerves, so that gives you feedback of how much pressure you're putting through your foot. So we know there's several factors that can cause or influence your chances of getting plantar pad atrophy. So those include diabetes, increased age, a family history, rheumatoid arthritis, obesity, a history of steroid injections, or in some cases poor footwear. And in terms of those that present to us in clinic, what we often see in relation to their symptoms, a pain on the underside of the heel or the ball of the foot when they make contact with the ground. Patients often describe the sensation of having no padding underneath, or that the bones are hitting off the ground as they walk. It's not uncommon for patients to tell us that they are unable to walk barefoot anymore at home because they just don't feel like they've got the cushioning that they need. And in a lot of cases, they have a burning or sharp pain on the underside of their foot as they walk. It's important not to mix this up with other conditions. So typically in forefoot conditions, they get misdiagnosed as Morton's neuroma, as a form of metatarsalgia or metatarsal joint pain. A lot of the times these conditions coexist together, but you can get fat pad atrophy in isolation. So in terms of diagnosing plantar fat pad atrophy, it can be a little bit difficult, especially for those that don't see foot conditions all the time. Normally we place people in standing and we're looking for a discrepancy from left to right in the thickness of the fat pads. So anything under 1 centimeter diagnosed as clinical fat pad atrophy. We can measure this with an ultrasound scan, and often we refer patients for this, primarily to rule out other conditions that may coexist alongside it. So the all-important bit, how do we treat this condition? It's really difficult because we can't obviously grow back the cushioning that is no longer present, so we try and substitute that with other things. One thing that we look at are insoles for fat pad atrophy. So typically these have extra bit of cushioning on the heel and under the forefoot, or an alternative is on the heel we put a bit of a horseshoe padding around it, and that just lifts up the heel and takes the pressure off the middle of the underside of the heel bone. We have some recommendations on a different video that we'll link in the description below, and the other thing that plays a significant part is having cushioned shoes. Unfortunately for some of you, it's trainers that we often recommend, and these are as padded as possible. So we often look at shoes like the Hoka Bondi 8, which has a nice plush cushioning, or a typical day-to-day shoe might be the New Balance 880 V13. Other options that we can try in the short term is taping the foot. So we just tape the underside to try and bunch the tissue up together, and that can give some temporary relief, especially in them severe cases, until we get them in the right type of insole and the right type of shoe. There are some surgical options for this condition, and that involves grafting adipose tissue from elsewhere in the body. There is some evidence to show this helps, but typically most patients return back to their baseline of symptoms after 2 years. So all in all, a difficult condition to diagnose, hard to manage, important to take the right steps to try and give pain relief. There's no long-term solutions for this. It's very much a condition that we try to manage well over time. If you have any questions, please leave them in the comment section below. If you found the video helpful, please like and subscribe to our channel.